New York Downtown Hospital is a community-based teaching hospital focused really on women's health and children's health.
We're a true community hospital right in the middle of New York City at the lower end of Manhattan.
I think it's very emblematic of what Lower Manhattan is all about. We have 30,000 new residents that have moved downtown since 9/11.
We're still the backbone provider to the Chinese community. And then we have the business community that swells this population to close to 750,000 people on any particular day. And those people need healthcare services.
I was born blue baby, and after my first operation, the cardiologist in the hospital referred me to Dr. Poon.
She was diagnosed to have congenital cyanotic heart disease, and the parents were young parents. They just came in from mainland China.
Having a doctor that speaks both Chinese and English, it helps a lot in the community because they don't need to feel that they're helpless. And my mother didn't feel helpless because she had Dr. Poon. I thank him and I think about him every time when I go through an achievement. I think if he wasn't here, I wouldn't be here.
I keep telling her is that we have other children like her. They all grow up. She can be anything she wants to.
Dr. Eric Poon, he's been involved with so many families and their children.
He was really the honorary mayor of Chinatown in addition to being the pediatrician in chief at the New York Downtown Hospital.
The hospital, they have the vision of serving the Chinese community in here. We do not have inpatient, and our nursery is a second level nursery. So for all the very premature babies, children who are very sick, they need to be admitted. We need to admit them to a tertiary hospital.
We needed a partnership that went beyond just a casual relationship. And we were thrilled that we're able to move forward now with this relationship with New York Presbyterian.
We entered into a new phase in that relationship, moving from an affiliation to what's called a sponsorship. Although we remain as a freestanding hospital, we and New York Presbyterian will be able to focus much more closely on improving the healthcare offerings to the downtown community, expanding our clinical programming, and providing for greater clinical integration between New York Presbyterian Hospital and New York Downtown.
We're looking to try to bring the resources of our nursery down to the hospital to upgrade the level of care for newborns as if it were here, as if it were on 68th Street.
We have to care for our children. That speaks volumes to me about the values that we as a society have. And at New York Presbyterian, New York Downtown, we're committed to making sure that we do the right thing by the communities we serve.
When our chairman of obstetrics and gynecology left, we basically said, this is a great opportunity now to collaborate with Weill Cornell Medical College and New York Presbyterian. We had this joint search committee for a new leader in obstetrics and gynecology.
This facilitated people throughout the country coming forward, and I was delighted in the fruition of Dr. Sultana.
This is really an honor and a privilege to be able to continue with the work that Elizabeth Blackwell started in 1853 in this very community, and to continue to be able to offer services to the women of Lower Manhattan.
We have a beautiful wellness center that's really focused on women's services and cardiology and all types of preventive services so that patients don't wind up in the hospital. Stavros Niarchos provided the funding for our mammography equipment, vital and essential equipment.
We'd like to have more people who work in the downtown community use the Wellness Center. And I think that the resources that New York Presbyterian has in terms of development and advancement, they can facilitate some of those conversations.
Due to the efforts and an idea from Dr. Atul Sharma, our chief of cardiology, we presented an idea where we could take technology so that our paramedics and EMTs out in the field on our ambulances could transmit EKGs back to the hospital so that we could make the best decision for patients right out in the field.
The Moody's Foundation was so eager to fund the virtual cardiologist. The proposal includes 2 new ambulances and retrofitting 6 other ambulances.
Moody's has been very, very supportive over the years of the role that the hospital plays in cardiac services, in prevention, and supporting our emergency department through our ambulance fleet.
Downtown Hospital is a beacon for Lower Manhattan. With the closing of St. Vincent's, it has put particular pressure on this hospital to make sure that we're meeting all the needs of every single Lower Manhattan community.
So now with New York Downtown being in this incredibly vibrant part of the city, to partner with an academic medical center like New York Presbyterian and Weill Cornell Medical College, we're really going to be able to take it to the next level.
We continue to depend on the contributions from corporations, foundations, and individuals to help us fund those inevitable budgetary shortfalls when they do occur.
We're going to be investing collaboratively with New York Presbyterian in something called a peripheral intervention laboratory. And then we're going to be building out collaboratively 25 single-bedded rooms. This is basically going to allow patients in our community to stay in their community.
Our belief is that we will show tremendous value to the downtown community in this partnership, and that by virtue of that, people will want to give to this institution because it's a resource that the community could not do without.
It's a jewel that's lost in the downtown area that many people don't know about. And I'm hopeful that with the New York Presbyterian name, that more people will become aware of this hospital.
Now with the new partnership, the horizon is up, the sun is rising again in Lower Manhattan. We're really going to do an outstanding job together to meet the medical needs of this very diversified and dynamic community.